Hello and good morning and welcome to Kim's Planet. My name is Kim and I'm hosting this segment. Today I'm going to be talking about Medicare and how to select a plan or why you should not select a new plan if you're already in one. Some good reasons why you probably shouldn't. And some of the things that you want to look at before you actually make your selection. First and foremost, I want to ask all of you, have you received yours? This is your 2020 Medicare and You handbook. If you're on Medicare, you should have received this before the annual enrollment period or open enrollment period. You should have received this a couple weeks ago, almost a month ago. If you haven't received one, contact Medicare, the Center for Medicare and Medicaid Services. Ask them to send you one because there's valuable information in this book. And actually, that's what I'm going to be talking about today. I'm going to be doing more of a tutorial on what's in the book, but I'm going to be sharing some additional information from a different perspective, perhaps. First and foremost, I want to make a disclaimer. I am in no way contracted with, work for, represent the Center for Medicare and Medicaid Services, not at all. Nor am I an insurance agent. I do not sell medical insurance, health insurance, accident insurance, life insurance, none of that. I don't sell it anymore, but I did, and that's why I made this video now. Because while I sold Medicare Advantage plans, that was my niche, I encountered thousands of people, I really did, only to realize that a lot of the people didn't understand what they were buying, couldn't quite grasp it, because it's a lot of information. If you look at this, you see how thick this is? I mean, if you live in a small town somewhere in the Midwest, this is your phone book. The good news, the print is pretty big. You can read it. See? So that's the good thing. But let's go ahead and get started. Most of you already know what original Medicare is. Your Part A is your hospital, Part B is your medical, Part D is your drug coverage. Drug coverage is not an automatic thing, by the way. That's something that you have to join into once you become a Medicare beneficiary. Once you become eligible for Medicare, then you can go ahead and sign up for a Part D program. And that is not GoodRx. That is not what they consider a drug program. They have different drug programs out there. You do have to find one. If you choose not to find one, there are fines and fees. And fines and fees are not a one-time slap on the hand fine or fee. No, it is a lifetime fine. It is a lifetime fee. So you want to make sure that you don't make that error and find yourself paying more money for services that you were entitled to for much less, even though they do come at a cost. Excuse me. Now, with your original Medicare covers 80% of all your hospital and doctor fees, 80%. That's it. The other 20% is yours. So imagine if you have a really, really big, serious situation occur, guess what? If you don't have your Medicare intact, if you don't have a supplement of any sort, you're looking at paying 20% out of pocket for whatever the procedure is. And again, that can be pretty costly for a lot of people. Now, there are some things that we can do. For instance, if you're low or moderate income, you might become a Dewey, as we said in the field. Okay, and what that is someone who qualifies for both Medicare and Medicaid. If you have Medicare and Medicaid, Medicare and Medicaid will take care of your services. What Medicare doesn't pay, Medicaid picks up. You would get that through your family department and social services or family services offices. If you know you're low to moderate income and you're barely getting by, you might want to go ahead and contact your local department for assistance and get that, because it takes care of your monthly premium. Yes, Medicare does have a monthly premium, and it also takes care of your Part D drug coverage and a few other things as well. So these right here are very important factors. Now, I do want you to know that there are agencies out there, free of charge, no money, that assist individuals. You can go to the Department of Health and Human Services in your local area. They may have some programs available or some workshops on how to select your Medicare plans. If you're going to look at a Medicare Advantage plan, if you're going to look at a Medigap plan, which is also known as supplemental insurance on top of what you currently have. And I'm going to go over that too as we get into it. Because people want to know, well, what's the difference between just a supplement, i.e. a Medigap plan, versus a Medicare Advantage plan? Well, first and foremost, Medicare Advantage plan is going to offer you everything that original Medicare offers, okay? But you no longer use your Medicare card while you are in a Medicare Advantage plan, okay? You kind of trade it out for the year, okay? And when you make that trade, what you're trading for is now you go to, and this is Medicare Advantage plans. Now, most Medicare Advantage plans, you're going to be connected with an HMO or a PPO. HMO, Health Maintenance Organization, PPO, Preferred Provider Organization. There's a whole lot of acronyms in this business. So the difference between the HMO and the PPO. And I'm just going to try to keep this really, really simple, give you some real general basic information, okay, that hopefully you can hold on to in case you have questions in your world, on your planet. You can go ahead and, ask. So where was I at? I was saying, I forgot. That's my disability, short-term memory, and that's why I don't work for real. That's why I made notes. I'll be honest with you guys. I'm cheating. I got a cheat sheet because I forget. So, okay, all right. What's it? Oh, I was talking about different agencies, right? Okay, I think that's where I was off at. So let's talk about, Health and Human Services. I did say that. And then there's another program also offered by the Department of Health and Human Services, and it's called the SHIP program. And I've called SHIP during this season, and it's a long, long, long wait on the phone, and then they tell you, well, you can leave your name and number, and we'll call you back when you're in line. And they called me back, and I was on hold even longer. So I decided, well, maybe this isn't, it's a good thing, don't get me wrong, but you got to have a whole lot of patience. It could take a while. And that's just where I'm located, which I'm not going to tell you where I'm located, but that's where I'm located. No, I'm not in a big city, by the way. I'm in a moderate-sized city, far from big. Okay, so there we are. Oh, I was talking about Medicare Advantage plans. That's what I was talking about. Okay, sorry about that, you guys. But yes, there's also the SHIP program and a few other agencies out there to help you out. Let's go back to the Medicare Advantage plans. So the HMOs, the PPOs. With the HMO, you have to work with a select list of doctors that are in the, quote, network. So you have to have network physicians. Most people are familiar with that. You choose your doctor out the network physician. They become your primary care doctor. And from there, they refer you to anyone else that they think that you need to see. Now, the thing about the HMO practice and a network doctor is you have to stay within the network. It does limit you. For instance, let's just say you went out of town for 2 weeks to go visit a family member and broke your ankle. Sorry if you did, and I do apologize. It's most painful. But let's say you had to go into the emergency room. Medicare is going to cover that emergency room visit because it was an accident. But now let's say they say, hey, you got to go to treatment like tomorrow. You got to. You got a problem. Let's say, there's just a lot of different scenarios. But once you're locked into that network, that's your network. And trying to travel outside of the network and seek medical attention can fall on you at 100% cost. And if you want to go ahead and try to appeal it, you can, and it'll take some time, but the bill is still yours, and it'll probably hit collections before the appeal is final. So just to let you know, that's the gist of an HMO. A PPO, a Preferred Provider Organization, they have more leniency. And what's nice about a PPO is you can actually go in or out of network. A PPO has a network. It does have a network, and then you can go outside of the network. You can find doctors and providers that just accept the insurance overall. Nice thing about a PPO is if you want to see a specialist, you don't necessarily have to be referred by your primary care physician. Some specialists will just go ahead and, they'll work with you depending on what your circumstances are. So that's a really nice thing. So that right there kind of covers the Medicare Advantage plan, kind of, sort of. There's more. Now, most people become eligible for their Medicare once they retire, once they reach, the age of 63, 65, wherever, 67. They've got it all over the place now. So, although I could be getting that all mixed up with Social Security, but the money part. But anyway, yeah, those types of things. Now, what is I don't want to go right there. Let's go ahead. If you have your Medicare New Handbook, now they may vary state from state. They probably do. But we can just kind of go in, and all the information that I have in mind, you should have in yours if you've got it. Should I have Part A and Part B? Yes, you should. Go ahead and get it while you can, unless you have a spouse that is still working and they are providing you with your medical, your doctor. When I say medical, I mean doctor. As long as they are providing you with your doctor and all of that, then yeah, stick with it. Just know that eventually you are going to have to go ahead and sign up for the Part B, okay? But yeah, in general, if you don't have a working spouse or any other type of health insurance, go ahead and get B. Now, trust me, you want your Medicare. If let's say you're already on Medicaid and you age into your Medicare years, please get your Medicare. Don't leave it all on the state. As a matter of fact, most states will push you to get on Medicare. Okay, if once you reach that age, they'll even help you fill out the paperwork. That's how kind they are. Yeah. Now, some people, and I'm sorry, I did say if you had a working spouse. Sometimes you don't need a working spouse. You could just have really awesome benefits, and I'm going to talk about that right now. If you have TRICARE for Life, and TRICARE for Life is a retirement medical benefit that military individuals, servicemen and women receive from the U.S. government and their children and their wives and their family. Now, this is most important for the wives, the family, and the kids who have grandfathered into a TRICARE for Life policy. Once you change, if you should buy another health and care policy, do you know that you have forfeited your TRICARE in most cases? Don't do it. If you have a sales agent coming to your house saying, oh, well, our insurance is going to cover X, Y, and Z, all the way to A, B, and C. You don't need that TRICARE. Ours right here supersedes it. You can do, no, you don't. TRICARE for Life is for life. Hold on to that. Never make a change. Never allow somebody to talk you out of that. That you need, okay? TRICARE for Life. There are a few other ones. If you were railway, I want to say railway, and some teachers have different benefits, different healthcare benefits set aside. They don't get Medicare. They get a totally different insurance. And again, some of these offer benefits where you can travel, you can choose whatever doctor you want. They're paying co-pays, deductibles. They're doing the whole thing. Why would you change? Because some nice person like me came over and said, hi, my name is Kim. Oh, I think this plan is just going to be a really good thing for you. It's just a perfect fit. Do understand that I'm a salesperson, and in the few weeks that Medicare has their open enrollment, annual enrollment, aka open season, in the few weeks that it happens, sales representatives can really make up to 6 figures in just less than 10 weeks. That is a lot of money, and it just depends on how they sell. Okay, you have rogue salespeople, you have salespeople like me who would feel bad when my superiors would be like, why didn't you close that sale? It's because the plan really didn't fit them. our plans fit everybody. You just have to figure it out. No, that's the whole purpose. Once you get older, you don't want to figure some things out. You just want to know that what you were told was the truth. So that's kind of what got me started on this crusade as well, thinking about it. And trust me, I thought about not making this video at all. I'm a procrastinator. That's one thing I'm good at. Okay? Now, I did talk about a little bit about Medicaid, and like I said, you go down to your local health department, and they should be able to tell you how to go ahead and get involved, and if you qualify. Okay, and again, it does pay your premiums, like whatever Medicare doesn't pay, the Medicaid pays your premiums, it pays your deductibles, and sometimes, your out-of-pocket expenses and whatnot. Now, let's say that you're a retiree, your Medicare is going to pay first, and any other insurance that you have is going to pay secondary. Let's say if you're 65 or older, the book says, have a group health plan coverage based on your or your spouse's current employment, and the employer has 20 or more employees. Your group health plan pays first if they have 20 or more employees. So if they work at, say, I don't know, a small business, some small firm, there's only 5 people in the business, in the office, and that's where your spouse works, and there's only 5 employees, Medicare is going to pay first of the insurances if you hold insurance through your significant. That's Pika, you guys. Okay, and then if you have, Pika, I'm recording. And then if you have, group insurance and there's more than 20 employees, well, what they're saying is that your spouse's insurance is going to pay first, or your significant's going to pay first, then Medicare pick it and pick up the rest. But you still want it. Now, this is the kinker. The way they have it set up, and trying to read this book, and the only reason why I'm doing it is because I had to go through training for like 5 months every year to make sure that I understood what I was reading, and they made us read it almost every day for 5 training, because actually I worked for an elite firm. I must give them that. We did have our issues from time to time, not me myself. I was a star, honey. I could do what I wanted to do. And you know why? Because I had integrity, and I didn't sell people just in any old plan. I didn't take them out of a plan knowing that it would be an irreversible move on their part just to receive a commission. That ain't right. That ain't right. All right, let me go back to my cheat sheets because I'm losing my place. I'm about to get all emotional. Let's talk about a Medigap. A Medigap plan. Medigap supplementals, A through something or another, A through J maybe. It's not A through Z. There's not that many, but there's quite a few. And Medigap supplemental plans are very, very good. If you have additional money, if you have more money than, some people who have retired, if you have a chronic illness, I would lean you towards a Medigap policy if you could afford it, if you have a chronic illness. A lot of people don't know that there are actually caps on how much you can spend annually, with your insurance. There are actual maximum caps. Some of them are $250,000, some of them are $500,000. The nice thing about a Medigap plan, a supplemental plan, is it tells you up front pretty much, hey, you can get sick up to $1.5 million worth of dollars of services and you're covered. But some plans, you find yourself in a bad situation. Did anybody see that movie? Denzel Washington was in it, and he had health insurance, and the service that his son needed was like $300,000, but it was maxing his insurance out, and his insurance and his benefit officers told him, sorry, we can't approve that. Yeah, that kind of goes above, you're going to have to come out of pocket on that one. We can't cover this. Nope. Yeah, that's real. And that's usually embedded in most policies. So let's take us to that. So when you get your policy, you certainly want to read your evidence of coverage, okay? Because that lets you know exactly what you have, what your limits are, minimum and maximum, Some of them, if you don't reach a certain minimum, you might owe them money. And that's something. You didn't come to the doctor enough. Guess what? You owe us. Really? I was healthy. Yeah, well, great news. You can pay us for being healthy. Help support those who are sick, I guess. Then you have other plans outside of the Medicare Advantage, and you have other things outside of a Medicare, Medigap. You have things like MSAs. What's an MSA? Never heard of it. Exactly. MSAs are medical savings accounts. This is where those of us who have a little bit more than the next guy, sometimes in most cases, we can actually set up an account, and it is specifically for medical services, and we put money into that account each year, and we opt out of Medicare, but we are not penalized because we have proof of insurance through a Medicare savings account. I'm going to get back on the Medicare savings account later on. If you have any comments and you want to know more about it, leave it, and I'll come back to you on that one. I'll answer your question. And being this is my first video coming up, I don't know. I might have a bunch of people. I might have two. So if I just have two questions, that's great. I'm going to get back at you. If I have a whole bunch of questions, give me some time. Give me some time. All right? Then you have private fee-for-service. Private fee-for-service is another option individuals can take. And it pretty much is what it says. It's a private fee for your service. You pay your doctors. Sometimes doctors have them in-house, and you set yourself up that way. And again, that's something else I'm going to talk about a little later in this. And the only reason why is because it's not so much an election, okay? It's just something you can do once you become Medicare age. But you're deciding right now if you're going to go with original Medicare, Parts A and B, with no attachment, no Medicare Advantage plan, no Medicare supplement, no MSA, nothing there. Now is the time to make that choice. I mean, it's like I say, it's the annual election period, annual enrollment period. Some people in business call it open season. I've had a lot of people tell me, "Oh, is it open season already?" Yes, it is, because you see it right now, as a matter of fact. Turn on your TV, give it about 15 minutes into your program. "Hi, I'm such and such. Are you looking for a new Medicare Advantage plan? And we offer extra things that Medicare doesn't offer, like vision, dental, and hearing." Know this, when you first come on to Medicare, and this is on your initial enrollment, the first time you come on, you have the opportunity to go get your eyes, your ears, and what is it? Your eyes, your ears, and your teeth. Yeah, you get a chance to go have them looked at. They don't do anything. They just give you a general idea. "Oh, you need a hearing aid and you need this." But Medicare does not pay for any of those services. It does not. And in most cases, Medicare Advantage plans don't either. What they offer is an annual checkup. You get an annual cleaning. And that, don't get me wrong, that is important, especially when we get older, we need our teeth. So just the fact that each year, sorry for that, you guys, each year you get the annual cleaning, that can be a lot right there. It really can, if you still have your teeth. Mine are, as you see, they're breaking down. Sorry about that, folks. But it's getting to the point where, I've got to get some dental done too. And dental is not cheap. Now, again, it's kind of a supplement. You can pull out a pocket and buy a dental plan, okay? Same with your hearing plan. You're going to have a hearing evaluation with a Medicare Advantage plan. Normally, each year you get a hearing evaluation. And yes, it is true. In some cases, they will cover a hearing aid, okay? So these are things that you want to be very, very, very specific. When you talk to a sales agent and they're telling you all the wonderful perks, don't give them your list of what you don't have. Give them the list of what you absolutely need. A salesperson's job is to find out where that void is, and when we come in, we can come in hard. Now, I've sold many things throughout the years. So when I say come in and come in hard, I'm not talking about specifically elderly people and disabled people and health. I'm talking about if you go into Big Lots, whatever those stores are. Sorry, Big Lots, let me take you out of my mouth. But, you go into one of the big stores, the first thing you walk in, "Hi, how can I help you? My name is, I'd be more than happy to assist you. Is there anything that you need?" "Well, what is it exactly that you're looking for?" You know how it goes. And it's annoying. Okay, it really is. Especially if you're just going in to browse, and you just step in the door and you got like everybody standing in line like a gauntlet, and they're like, "Hey, how you doing today? Yeah, let me know if you need anything." Yeah, no. Anyhow, let me get off of that. So, yeah, I did sell insurance, health insurance, Medicaid, Medicare, not Medicaid, just Medicare health advantage plans. And I did that for quite some time. I sold in over 40 states simultaneously. Um, I was a go-getter, but I wasn't a rogue. And because I was a go-getter, like I said, I get in trouble because I wouldn't sell everybody. I mean, sometimes I'd meet people and it is not what they needed. And I just want to make sure that nobody gets duped this year. Now, here's the good news. You have until the end of December to go ahead and get your Medicare set up, your Medicare Advantage plan, supplements, and all of that. It is the time. You only have this short period of time to make any types of changes in your Medicare plan. Once you make the change, your benefits are going to begin on the first of the year, unless, of course, you start your plan December 31st and the next day is the 1st. Come on, you already know. But the good news is once it processes, you'll still have your benefits available. But don't make a change December 31st and go to the doctor on the 1st. Because what's going to happen is they're going to bill you out at Medicare rate, and you're going to have that 20% overage. And maybe, or maybe not, your Medicare Advantage plan will pick that up. So be mindful of things like that. I'm getting close to time's end. So this right here was my very first video. Hopefully I can remember tomorrow based on my notes. I'll watch this a couple of times, see how I'm going with it. And yeah, you guys, until tomorrow, please come back and land again on Kim's Planet. More talks on Medicare Advantage plans and the annual enrollment. Have a great day.